All over the world, we're seeing the devastating impact of this invisible killer.
COVID-19 is obviously a disease of the human body, but the virus, of course, is also a social phenomenon.
The impacts and the lockdowns, the retreatment of services, the increased pressure and stress on families' lives, those are all part of the realm of social science.
Social science is actually at the very heart of a pandemic that is spread from person to person through contact, through engagement.
Asking people to wash their hands, to cough in their elbows, to wear face coverings, to maintain social distancing. And a lot of this was about communications, it was about understanding, and it was about behavior. So the social sciences soon became quite pivotal in getting us out of the pandemic.
The Oxford COVID-19 Government Response Tracker records government responses to COVID-19, including things like school closures, workplace closures, travel controls, vaccine policies. The primary focus has been on trying to understand how we can get the most effective control of the disease through the right mix of policies, and how the right mix of policies might vary across countries, across time, might vary across the different stages of the pandemic. And it's powered by a team of hundreds of volunteers from all over the world who are collecting this information in real time and making it available for free as quickly as we can.
Oxford University keep track of how tough border restrictions are in every country,
ranking countries from 0 to 100 in terms of their level of restrictions.
And that allowed us to much better understand what countries were doing, what was impactful and what was less impactful, and help the global dialogue on what the best response to the crisis could look like.
When the first lockdowns happened, we knew that violence against children was going to rise sharply.
We didn't have that opportunity to say, okay, wait, before you use this, we need to do a very rigorous randomized control trial and understand what the moderators and the mediators are and look at the cost effectiveness of this intervention. The need was immediate. Families that didn't have very much time with their children maybe before, suddenly were having to take care of their children 24/7.
And so we took evidence-based parenting programs, which we'd worked on for the past 10 years with UNICEF and the World Health Organization.
And we put them into these easily digestible and adaptable resources that could be readily available.
The work of the Parenting COVID-19 has been absolutely impactful, both at family level and at community level. It's really made parents understand that they're being supported and communities understand the importance of parenting.
We brought together a unique collaboration of major UN agencies in a united group with over 200 NGOs around the world. We delivered these resources to every family possible.
200 million people
in 198 countries
with 33 national governments making it part of their COVID-19 response.
Obviously, we were in the middle of the pandemic and there were some major issues, which was the reason that the British Academy and the Royal Society collaborated on a series of reports. And Melinda Mills was the leading researcher on two of these. The first was on face masks.
Western countries were quite reticent to introduce face coverings. What we saw in our review is that many other Asian countries basically got out their Pandemic 101 manual, and face coverings was one of the most important aspects. We brought this systematic review to the government, and within a week the policy was changed and face coverings were introduced for the general public.
The second bit of research that we collaborated on was around vaccines and vaccine engagement.
We looked at how you could effectively deploy these, but we also looked at the social behavioral barriers. People were concerned about the confidence and the safety, and we had to understand how to communicate this across different groups. We also looked at vaccine misinformation and disinformation, and we met with large social media companies, we met with the government, we met with policymakers. It was very gratifying to see our research used very actively, but also, for policy changes to take place very rapidly.
Each and every one of us is now obliged to join together to halt the spread of this disease.
The social sciences is going to be pivotal in moving forward and understanding a post-pandemic world.
Actually, we need to understand not just what the disease does and how people get sick and how they get better, but also how people change their behavior or not change their behavior. Will these governments put in new kinds of restrictions or to not do it? What the effect of those restrictions might be on populations. And it's really the integration across different sciences that is going to be needed for this kind of massive scale of challenge.
Everything that we produced, we also made open source and open access for other people to scrutinize, for other people to reuse.
We have a common challenge. This pandemic will not be solved anywhere until it's solved everywhere. And that creates this real imperative to think about how we come together.
I can't imagine doing research without collaboration. What you need is expertise. It doesn't matter where people are. It doesn't matter what department they sit in.
COVID-19, climate change, all of these things take collaboration to really overcome.